Hello, everybody. I hope y'all are well this week. Thanks for allowing me to take a bye week last week. Um, I just wanted to kind of move into a different topic this week, and it's going to be about respiratory diseases or pulmonary diseases. I'm doing this one primarily because a good friend of mine he's had a pulmonary fibrosis, but it just got really a lot worse. And so now, he was in the hospital. Now he's on high dose steroids and on oxygen and all that kind of stuff. So I just wanted to explore the options for CBD and cannabis in the setting of respiratory diseases. What are they? What are respiratory diseases? There's a very broad category of illnesses that affect the lungs and the airways. Um, Asthma is very common, especially in children, but you can actually sometimes grow out of that. COPD, which is chronic obstructive pulmonary disease, bronchitis, and emphysema all kind of fall under the heading of COPD now. It used to all kind of be separate, but the guidelines have changed a little bit so that when you talk about COPD, you could be talking about emphysema or chronic bronchitis. And then the last one is pulmonary fibrosis. So asthma, it's a chronic lung disease, but like I said, if you're a kid, you could possibly grow out of that. But what happens in the setting of asthma is it causes this inflammation and narrowing in the respiratory airways. And this leads to episodes of wheezing, shortness of breath, chest tightness, coughing. And sometimes these asthma attacks are triggered by things like exercise, cold air, allergies, or smoke. COPD, again, this is a group of lung diseases, including chronic bronchitis and emphysema. And if you have any one of these things, you have a hard time breathing. In these diseases, the patient has trouble breathing because there's restriction in the airway. So it's not so much an inflammatory process, though there is some inflammation going on, but it's more of a restriction in the airway, and this causes limited airflow. And then in the case of emphysema, it's a little different. There's this abnormal permanent enlargement of the air spaces at the terminal bronchioles and deterioration of the alveolar walls. So let's just talk a little bit about what the lungs look like. So you got your lungs, there they are. You got your trachea, comes down like this into about this area, and then inside the lungs there's a big tube that goes down, and then off that big tube there are little branches. And at the end of those little branches are these little things called alveoli. The alveoli is where carbon dioxide and oxygen are exchanged. So if you've got, like I heard one time, if you stretched all that out, it would cover a football field. That's how much surface area there is inside the lung for air exchange to occur. So in the setting of emphysema, these the alveolar walls, or the walls of the alveoli deteriorate. And so if those deteriorate, then there's no surface area for oxygen and carbon dioxide to be exchanged. So this can be a very serious condition. See, all these are very serious conditions, no doubt. But the setting of emphysema, it's usually the cause of that is long-term exposure to irritating gases or particles such as secondhand smoke or air pollution. If you grew up in a home where somebody smoked cigarettes all the time, you've been exposed to secondhand smoke, and raise your hand if that's you, because that's me. That's my sister. I can remember my dad going into the bathroom in the morning, and we had one bathroom, and he would sit there and smoke while he pooped, and he'd come out and it would just be like this this thick fog, smoky, nasty, and I'd go in there to get ready for school and go to school smelling like I just smoked. So it was disgusting. But that's what, you get exposed to that secondhand smoke, and you can also develop some of these diseases even though you never smoked. So unlike asthma, COPD conditions like a chronic bronchitis or pulmonary fibrosis or emphysema cannot be reversed or cured. There's really no cure. What we do is we manage symptoms. So with pulmonary fibrosis, this is a different kind of pulmonary condition. It's where the tissue in the lungs gets really thick and scarred. And the scarring then keeps there from being adequate oxygen exchange. So you can't pass the oxygen from your lungs into your bloodstream, and this eventually leads to respiratory failure if left untreated. There are two types of pulmonary fibrosis. There's idiopathic, meaning there's no known cause, they have no idea why you have it, or there's interstitial pulmonary fibrosis, and that's a non-idiopathic. So we know for sure that something caused the interstitial disease, and it's most likely, exposure to toxic chemicals and that sort of thing. So that's just a little overview of what the pulmonary or respiratory diseases are. The treatment for these is really kind of all the same. So in asthma, we usually manage patients' asthma by giving them inhalers. You have an inhaler that's considered a rescue inhaler, and you should only really use that if you're having an episode of wheezing. Maybe you've been exposed to pollen in the air and it's gotten into your lungs and you're wheezing. You can use your rescue inhaler, and sometimes that's all that people need. But then if their asthma is a little bit more serious and more involved, then you would use a different kind of an inhaler. So they have beta agonists, they have short-term agonists, long-term agonists, all these different formulations of inhalers. I lost my word for a second there. But that is how we manage asthma. So the goal of therapy in the setting of asthma is to prevent acute episodes and to provide relief by making healthy lifestyle choices with those prescribed inhalers. So of course, if you got asthma, you shouldn't be smoking nicotine. You want to avoid the things. Sometimes people just have exercise-induced asthma, and in that case, they might use their inhaler before they exercise, and it manages their symptoms just fine, and they can exercise. And we don't want people not to exercise, so that's important that that's used properly. So in COPD, it's estimated that 32 million people in the United States have chronic obstructive pulmonary disease, chronic bronchitis, or emphysema. The treatment approaches for all of these conditions are very similar to asthma. So we use the rescue inhalers, we use the inhalers that control symptoms long term. There are also some oral medications out there that are kind of newer on the market to prevent exacerbations of bronchitis or COPD or emphysema. And then a lot of times, in an acute setting, you might have to do a steroid. The new therapies are to avoid steroids until absolutely necessary, because steroids have their own nasty set of adverse reactions. So they're usually just used to prevent or in not really prevent acute exacerbations, but in the setting of an acute exacerbation. So if you were to come into me and you were wheezing and you couldn't breathe, you would use your inhaler. We might give you a breathing treatment in the clinic, and I might give you a steroid to take for 5 days. So that's that. The other things that just make sense are quitting smoking, avoiding the toxic fumes and other exposures, and then sometimes going to pulmonary rehab can be very, very beneficial. And then, because we want people to exercise, so going to pulmonary rehab, you're in a setting where you're being monitored, your blood pressure is being monitored, your oxygen levels are being monitored, and you're able to exercise under this monitoring condition, so you can get your lungs stronger. That's what we want. The bronchitis situation can be acute or chronic. If it's chronic, that means you've had a persistent cough for longer than 3 months, and it's got to be 2 consecutive years for that diagnosis to be made. So a lot of times people just get acute bronchitis, and they come in, they want an antibiotic. It's not indicated. So we usually just do the inhalers, maybe an oral steroid pack or something like that. Pulmonary fibrosis. So the current treatments for managing this are slowing disease progression. The other sort of components to this is just addressing other comorbidities. So if the person has COPD, managing that. They might also have obstructive sleep apnea, so we want to manage that. You might have GERD, or gastroesophageal reflux disease, and you might also have coronary artery disease. So in all these comorbidities, those things all need to be managed as well in order to allow the lungs to have less stress on them. With the diagnosis of idiopathic or non-idiopathic pulmonary fibrosis, we want to stop any kind of nicotine intake, manage those underlying conditions, use oxygen if your room air pulse ox or your oxygen at room air is less than 88%. And then, of course, pulmonary rehab will really improve your exercise tolerance. You want to eliminate any toxic exposures, and that includes medications too. And if there's an infection that occurs, like pneumonia, it needs to be treated promptly. So that's the conventional, that's the description of what a pulmonary or a respiratory disease is. It's the conventional approach to how these treatments are, how these conditions are addressed, and that's just really a very slim list. It's a lot more involved than that, but that just gives you the basic understanding. And so the next video, I'm going to be talking about where do cannabinoids fit into the management of respiratory diseases, and do they? Well, stay tuned to find out. Y'all have a good day.